Work. It's where most of us spend about a third of our day. So it makes sense that our experiences at work can have a major impact on our health and well-being. Risky alcohol use is a serious social and health issue in Australia, costing around $14 billion a year, including $6 billion in reduced productivity. Alcohol in the workplace can be a toxic mix, one that impacts on performance, occupational health and safety, and the economy.
Risky alcohol use in Australia can cause major health, social and economic consequences, and these impacts can be felt not only by the individual, but also by their families, workplaces and the community. It causes injury, disease, disability and death, and is second only to tobacco as a preventable cause of drug-related harm and hospitalisation. Effective workplace health promotion can provide benefits for staff and employers and the community more broadly. Through VicHealth's Creating Healthy Workplaces program, we aim to inspire and put in place practical solutions for employers and workplaces so they can reduce alcohol-related harm.
Work-related alcohol use involves drinking that has an impact on the workplace and drinking that is influenced by the workplace itself. Around 90% of Australians who work consume alcohol. The majority of drinking takes place after work or on days off, with comparatively little being consumed before or during work hours. In a recent Australian survey, however, almost 9% reported drinking alcohol at work, and over 5% reported attending work under the influence of alcohol.
Alcohol use in the workforce is an occupational health, safety and welfare issue. Employers need to consider the many effects risky alcohol use can have on the workplace. It can result in a loss of workplace productivity due to absenteeism, poor decision-making, illness and even death. Additionally, harmful alcohol use in the workplace can produce long-term economic burdens in the form of compensation and employer liabilities. Lost productivity in the workplace caused by alcohol costs employers hundreds of millions of dollars, and absenteeism is also a significant cost. Importantly, the benefits of addressing alcohol problems in the workplace include safer working environments, decreased accidents, injuries and fatalities, and greater compliance with occupational health and safety related legislation.
Not only does risky alcohol use cost the workplace economically, it's also bad news for workplace safety. Individuals are put at risk from staff who are intoxicated or hungover. People under the influence of alcohol experience impaired coordination, slow reaction times, and poor judgment. This can result in workplace accidents, injuries, and fatalities. In Australia, between 3 and 11% of all non-fatal workplace injuries may be attributable to alcohol use. Workforce groups that are most at risk include men, young people aged 14 to 29 years, those in lower skilled and manual occupations, and those employed in the agriculture, retail, hospitality, manufacturing, construction, and financial services industries. Workplace factors that can increase the risk of alcohol use and related harm include organisational culture, availability of alcohol, and discrimination, bullying, and harassment. Benefits for workplaces in reducing alcohol-related harm include increased staff performance and productivity, decreased staff turnover, reduced operating, reputational and indirect costs, and improved work relations and staff morale.
Yes, the workplace presents particular challenges when dealing with alcohol-related harm, in part due to its potential negative impact in terms of workplace safety, accidents, injuries and productivities. But the research clearly demonstrates that the workplace can be an effective setting for addressing alcohol-related harm. But in order to do this, high-risk industries and occupations need to be identified. Moreover, workplace programs need to operate at different levels, in particular targeting individual employees and organisational factors. And workplace programs need to be tailored to meet the specific needs, resources and cultures of different workplaces.
The workplace is an important setting for reducing alcohol-related harm. The prevalence and patterns of alcohol consumption among the workforce have important implications for workplace safety, workers' productivity, and the development and implementation of strategies to address alcohol-related harm in the workplace. Effective responses are likely to commence with the recognition that there is no single reason for risky alcohol use, no single alcohol problem, and no single effective response. For more information on Vic Health's Creating Healthy Workplaces program, visit vichealth.vic.gov.au/workplace.